Health Psychology Studies, Interview Study and Heroin Study, Blattler et al., 2002. Aims. The aim was to look at maintenance treatment for heroin users who also used cocaine, also known as polydrug use, in order to see the effect of heroin maintenance program on their cocaine use. The study examined dropout rates for treatment to see if it was higher when the heroin users used cocaine as well. It also looked at how cocaine has changed among those who stayed for the treatment. Procedure. The study used the Medical Prescription of Narcotics Program, also known as PROVE, which involved prescribing heroin for heroin users. The researchers chose a group of heroin users on the PROVE program and compared baseline measures with follow-up data. The study took place in a naturalistic setting. The participants were on the program in any case. This is called a cohort study because one program or cohort of people is followed over the course of a program. It is also a longitudinal study using the same participants. As well as following the main group, there was a series of clinical trials on a smaller subsample of the main group. Ethical approval was given, and there was a safety assurance group that monitored the ongoing medical therapy. Trained independent interviewers questioned the participants at intake and every 6 months. Using a standardized questionnaire, urine tests, urinalysis, were carried out at intake and randomly with notice twice a month. Medical examinations for HIV and hepatitis were carried out at intake and every 6 months. There was a questionnaire for those leaving treatment to discover their reason for doing so. Data was recorded about dosages, the time of administering the treatment, and any other medication being used. The treatment was a prescription of narcotics, a daily injection of heroin. There was also psychosocial and medical care, and counseling was mandatory. From 1994 to 1995, 995 patients were selected. They had been admitted to a heroin-assisted maintenance treatment program. At the end of the 18 months of follow-up, the interviews stopped. Of the original 995 patients, 486 did not have 18 months follow-up, so were excluded from the study, thus leaving 509 participants. The participants had to be at least 20 years old, addicted to heroin for at least 2 years, with at least 2 previous attempts to be treated without success, and they have to give informed consent. People on the testament were expelled for drug dealing at the treatment center, smuggling substances, using violent behavior, or for non-compliance with the treatment or research guidelines. The confirmed use of illicit substances did not cause them to be expelled. Method. Cohort study in a naturalistic setting. It was a longitudinal study. Standardized questionnaires, interviews, and clinical assessments were used, for example, urine samples. Results and conclusion. Results at baseline were when the participants started the treatment. There were 266 participants involved in giving baseline measures. 98 were female and 168 were male. Their mean age was 30 and their mean duration of using heroin was 10 years, with the mean duration of regular use of cocaine being 7 years. The heroin maintenance program took place in 6 clinics. Among the participants, 75% preferred to inject both heroin and cocaine, 33% drank alcohol, 23% used no cannabis, 31% were considered daily cocaine users, 54% were considered occasional cocaine users, 16% were non-cocaine users at intake. These measures included self-report data. Results after 18 months. After 18 months, 247 participants were followed up. Self-report data and urinalysis were used. After 18 months of treatment with prescribed heroin, the cocaine use decreased from 84% to 48%. For daily users, this was a fall from 30% to 6%. The change in the number of non-users went up from 16% to 52%. Conclusions. Non-users of cocaine went up from 16% to 52%, which is a large rise and would be considered successful. The number of daily users of cocaine fell from 30% to 6%, which is a large fall. The results show that 75% of the participants had urine tests that were negative for cocaine, even though some of them still claimed that they used cocaine. Clearly, the treatment did not mean that cocaine users had stopped using altogether, but there were many who did stop. It was reported that most of those who continued to use cocaine reduced their use from frequent use to occasional. Overall, 84% used cocaine at the start of the study and 48% at the end, which is a successful difference. It was found that behavior corresponded to the results. For example, those who used to inject both cocaine and heroin, as discovered from the intake interview, were more likely to continue to use cocaine. Cocaine use at 18-month follow-up was also linked to prostitution, illicit heroin use, illegal income, and contact with the drug scene. However, these features decreased over the 18 months of treatment, so there was some effect on behavior as well as on drug use. Evaluation strengths. There was good attention to ethical issues, including getting clear informed consent at the start and having the treatment and study monitored throughout. Using interviewing questionnaires and urinalysis means there are qualitative and quantitative measures, which adds detail and validity to the results. For example, self-report about not using cocaine can be checked against urinalysis. This is a naturalistic study and there is no manipulation of variables, so the results should have ecological validity. The researchers checked as many variables as they could, including the price of cocaine between 1994 and 1996, which remained relatively low, so they did not think factors like that affected the findings. Reduction in cocaine use did seem to come from the treatment. Weaknesses. The dropout rate from the treatment was 11%. Some participants left for alternative treatments. There may have been a pattern in dropout, and those left on the treatment may have been different in some way, causing a bias in the findings. However, the researchers checked for a pattern in dropout related to cocaine use and did not find one, so they were thorough in their sampling. It is possible that being on the study and being interviewed, tested, and observed affected the findings because the attention may have altered the behavior of the participants. Therefore, the findings might not be valid. This is known as the Hawthorne effect, reported improvements even though this may not have been the case. The researchers have emphasized possible problems with generalization. They point out that generalization should be only to heavily dependent, long-term polydrug users with multiple health and psychiatric problems. Generalization should be in the light of the Swiss situation and the heroin project. The researchers also point out that the study relies on self-report data, which may not be 100% reliable. People claimed they took cocaine when their urine tests showed they didn't.